Thank you again for being here, and thank you, Catherine, for doing an amazing job just setting the stage for our conversation. I'm Ritu Chatterjee. I've met most of you here so far, and I'm here to talk about continue the conversation on caregiver mental health. And I I'm very excited to introduce our panelists, our wonderful distinguished panelists. Here to my left, we have Boniface Kakabwe. He is an early childhood development expert with over 20 years of work experience at global, regional, and country levels. He currently serves as early childhood development specialist at UNICEF headquarters in New York, providing leadership on nurturing care, ECD financing, and partnerships. Then we have Orly Athan. She is a clinical psychologist specializing in maternal and reproductive health, and is a professor at Teachers College in Columbia University, where she created the first graduate level courses and certificate program in these subjects. And her research extends beyond sort of the immediate postpartum period, which we will talk about. And you've already met Tanmoy, our colleague from India. So just to set the stage a little bit more, we'll be talking about parental mental health, caregiver mental health. So just to sort of, here in the US, for example, I was looking up at the latest CDC numbers. About 1 in 8 pregnant women and moms experience depression during pregnancy or in the 1 year postpartum. And about 1 in 5 experience anxiety disorders. And there was a recent study, I think in JAMA Psychiatry, which found that about a quarter of maternal deaths here in the US, which, as some of you might know, the US among developing countries is pretty bad when it comes to rates of maternal deaths. We have very high rates of maternal deaths. A quarter of those maternal deaths are actually due to maternal mental health and substance use issues. A quarter. So the highest, even more than postpartum hemorrhage. Globally, according to the WHO, 1 in 5 women experience a mental health condition during pregnancy or the 1 year after giving birth. And the risk of having these mental health issues is, of course, higher in some groups. If somebody's had a mental health issue prior to getting pregnant, you're more at risk. Pregnant people who have a lack of social support, which came up quite a bit in the previous panel. And then if you have pregnancy complications, the same JAMA Psychiatry study, which is talking about maternal mental health being responsible for the largest proportion of maternal deaths, also found that over 40% of parents who've struggled with pregnancy complications and have a baby in the NICU, so preterm, had a preterm baby, which Catherine also talked about, so 40% of them are end up having struggles with mood and anxiety disorders. So I want to turn to Boniface first. Of course, we learned from Catherine how maternal mental health during the prenatal period can harm the fetus or influence the fetal development and also later mental health. So from your early childhood development perspective, how does perinatal depression, postpartum depression, and other kinds of mood disorders, how does it influence early childhood development?
Yeah. Thank you very much. Pleasure to be here. And it's also good to speak after Catherine because I think she has laid the foundation. Yeah. But also just to put in context, you heard I'm with UNICEF, and not only the headquarters office in New York, but in my responses, I'll also be touching on the countries out there because we are working in over 100 countries. But again, the main focus of this conversation, we are talking of also when the caregiver needs support, needs care. So for us, in UNICEF, and also I think it's the mood in this room, it comes all from the whole nurturing care framework, which maybe some of you are aware, which was launched in 2018, the World Bank, UNICEF, WHO, where we are saying children need 5 components: good health, adequate nutrition, responsive caregiving, opportunities for early learning, safety and security. But you see, the 5, the nutrition, the health, we know most countries are better off. Yeah. But once we start talking of now responsive caregiving, it becomes a challenge. That's where now the link with what Catherine was talking about comes in. I heard the questions from Brazil to say pregnancy is maybe unwanted, and how do you link that? So that's why I think the issue now for us in the UN or in the UNICEF, we believe that mental health is a piece that we need also to address, because it's a reality. I think she has brought all the figures before us, but what else can be done? Because we need to link now the early childhood development. So from the Lancet series of 2016, it says, unless you address the mental needs of the caregivers, of the parents, you cannot achieve the nurturing care that we desire. So the connection is that one, that we may aspire to say we want the child to have these 5 components which are of nurturing care, but if you don't address the emotional needs, the self-care, then you are not going to achieve that. So in 2018, when we were launching the framework, elements of caring for the caregiver was not there. But throughout the 5 years, we launched the report in June last year, progress report for the nurturing care framework, where we have highlighted now that there is really a need to say, in addition to the 5 components, don't just look at the child, don't look at the children themselves, but also need to address now the needs of the caregivers. Because the expectation is we want the parent to do ABC to take care of the child. But if I'm a dad of a 9-year-old daughter, sometimes you come from work, the daughter just looks at you, hi daddy, but that is not responding the usual way. So we find that the child, we're expecting the parent, but the hypothesis or the issue is work with the parents, address the needs of the parents, then you're also going to now get the support that we require for the child. So there's a very strong link between child development and also the situation or the mental balance of the parents themselves. So in UNICEF, mental health is a big agenda for us. We have a framework that we tested in 2022 and launched in 2023 that takes a life cycle approach, addressing all these pieces that I've said. So
I want to get into that in a little bit, a little more details about what that framework involves. But just to again reiterate, in terms of the impact on early childhood development, so a parent that is unable to be responsive and be able to bond correctly if they're struggling with their mental health, if they're unable to form the appropriate attachments, that we know has a huge impact on the child development, as the early development of the child as well. Yeah. But I want to turn to Orly now, because your work includes, but also goes beyond sort of the pregnancy, postpartum period, which is a year after giving birth. And you look at sort of motherhood in general, because the whole period involves a lot of strain, stress, and pressures. Tell us about kind of this period that you study. What is it called, and what does it look like, and the fact that we don't talk about it much in society?
Thank you. Also a pleasure to be here and learning so much already, and I have some comments on the nurturing care framework. Once maybe I can educate you on a term called matrescence, like adolescence, to put you in a state of thinking about the developmental experience of the transition to parenthood, in which there might be an acute stage, right, like this, now I'm pregnant and or inviting a child however I do into my life, but then also thinking about it from a life cycle perspective. What does that mean over the course of my reproductive life cycle, and how can I sort of build reproductive life satisfaction? So if you think of matrescence like adolescence, then you might go back to your own adolescence and you might remember what that was like, which meant that as you entered puberty, it wasn't just change in one area, like your physical self or your, neurological changes, but that might have started to, generate a whole upheaval in many ways, a disorientation psychologically, because you were questioning a lot of things. You were shifting your friendships and your peer relationships, how you were relating to your parents. You might have been taking more or less risks. You might have changed your, your economic standing in the home. You might have now been expected to, bring home an income. You might have started to ask the big questions like, why is life so unfair? Why do some people have and others do not? And so, and what do I believe in? Do I believe in the things that I inherited in my family? So this kind of 360, not only biopsychosocial change, but really there's a whole other half side of the pie, which is the ideological changes. And really, when we look at that level, we're really seeing a worldview change. Now, for the mother, now let's think about that, right? And matrescence comes from an anthropological term, which was a biosocial sort of framing to think about the biological event of a pregnancy. Now, your culture is going to say, now you're a mother. But how long does it take psychologically for the person themselves to say, I feel like one? Or to say out loud, even courageously, I regret it? Or there are many mothers that I've worked with, I think their kid is about 9 or 8 when they finally sort of settle in, right? Or when the child goes to maybe their first time in primary school. So they're going to experience the very same things. We now finally have some science, neuroscience of the changing brain, right? The pejorative baby brain, all of the ways in which, if we look at it when deconstructed from even a feminist lens, we're quite problematic. We actually see something much bigger happening, even at the biophysiological level. But you're going to hear, and you will often, the peer group changes, right? What are the other mothers from that I pace this experience with? You're going to hear a lot of stress around. So even if we were to look at it like a psychiatric assessment in which we're going to look for stressors and places that we really want to scaffold support around, you might hear it around, hitting the economic or maternal wall, right, and before the glass ceiling. You're going to hear it in terms of, wait a second, this is not sustainable. The way I am expected to carry out family life is not sustainable. And someone's falling sick, and I'm the identified patient. But it's really the opportunity to look at the whole enchilada, I think, to really, think about what might be wrong about the structures that are supporting the mother. So while the mother's holding the baby, who's holding the mother? And that brings me to nurturing care framework, which I'm delighted we've met and that I'm learning about this extension of the work. We're just writing a small kind of commentary on redesigning healthcare for mothers to really bring in even the nurturing care framework. Okay, of course, above and beyond nutrition and the basic sort of hierarchy of needs, what about nurturing environments, enriching environments for the mother? And one of the first ones I would imagine would be even basic education and literacy, reproductive health literacy around what is happening for the parents or the caregiver. Let's even just say for the caregiver. Literacy around this, because one of the common refrains you're going to hear is, why didn't anybody tell me? Most people enter into these experiences with a sort of sense that this information is given. And it's not until they hit a crisis in which the self-reflective process and the curiosity and the challenging and the wondering happens. And also advocating within the home could be quite dangerous, right? Because there are, and outside, because there are reasons why some of these structures are in place. They are beneficial for some, but not for others. And to really think about also, this idea of support, which is really truly the usual suspect in the science and the lack of it. Who is caring for not only, what environmental supports there are, but also are they enriching? So I'll sort of leave it there.
Yeah.
But I really want you to think about this as a big idea. That's my last kind of comment, which is, I just came back from a conference as well in Tempe in psychology at the APA. There's only one sort of division that thinks about big picture ideas, you know, not sort of getting into the science needs to go deeper, but sometimes we need to go back and think of frameworks. And what makes a big idea is one that is, you know, relevant and resonant for particular people in a particular time and context and geography. And I encourage you all to kind of think of this idea as a big idea, but then to really contextualize it and think about how would that make you change how you think about your community and what supports you're giving for the caregiver. So thank you.
Thank you. So we've talked about mothers and pregnant people, but as I think Alison Gopnik yesterday brought this up, I think Michael might have brought it up as well, that we have to think of the partners of the birthing parent. And fathers who are often left out of this conversation, and yet increasingly here in the US and in many parts of the world where the village around the new family is shrinking, fathers and the non-birthing partner is taking on more of a role in the caregiving. So, Tonmoy, I want you to talk about your own experience of entering fatherhood, what that was like, but you've also done some thinking and work on sort of the transition into fatherhood and what that entails and how we need to start thinking of fathers and non-birthing partners as well in this equation.
Yeah, sure. Thank you. And yeah, just amazing to listen to all of you. So I think men, fathers, but men in general, we occupy like a really strange and sort of like very fractious, tortured sort of position in this entire conversation, because we are everywhere. Men are everywhere, occupying space where they ought not to, and at the same time, you know, this sort of like parenting conversation, we are nowhere. So I became very mindful of this sort of tension as I was approaching fatherhood, and the most difficult, the most tortured episode of my life, I think in the last 18, 20 years, lived with mental illnesses all my life, but I think that period of sort of 1 year before we had our son, and then about 2 years after, were probably the most sort of intense, painful time of my life. But I do want to caveat that by saying that, I mean, as I write in the editorial of the Early Childhood Matters journal, this edition, I do feel like confident, sorted parents are a bit like unicorns, like they don't exist. So whether or not you have a diagnosis, whether or not you have the identity of somebody who has a mental health struggle, I think this is like a shared sort of pain that all of us as parents sort of.
You mean the transition and the discomfort, yes, and the growth,
all of
what,
this, yeah, like everything that comes with, the whole baggage that comes with being a parent, right? As far as fatherhood goes, I think the undeniable reality, at least in our part of the world, is that the primary role of the father is still not to sort of be the touchy-feely person or provide emotional nurturance, but put food on the table, right? And during the pandemic, of course, that caused all sorts of upheavals in that sort of dynamic. And that caused a very profound crisis of masculinity, as it were. What is your role? Because nobody had taught me, I didn't get that lesson from my father, from any other male influence in my life, that I could play a different role as well, that my only job was
as a caregiver.
As a caregiver, right? So I feel I have to give huge credit to our generation of parents in general, and also men. I feel like in one generation, we have really managed to flip the narrative a lot. And we don't give ourselves enough credit for this. Catherine somebody was talking about intergenerational love. Yeah. And I feel like, while it's an amazing idea, personally, I've experienced it in a very painful physical way. I want to give you this image of, when your brain is programmed to respond to your child's behavior in a certain way, often that response is a violent response, is an angry response, is an abusive response even, which is something that I experienced growing up. And then you say, no, I'm not going to respond in this fashion, right? I feel that I experience that moment as like having these hooks attached to my spine. They're pulling me in one direction and I am pulling away in the other direction. I'm saying no. And so the flesh and the bones and the muscles, they get ripped apart in that process of reinventing your response and saying, I'm going to end this with me. As a father, I'm not going to perpetuate this sort of like same cycle of violence, emotional aloofness, whatever it is. So doing that while figuring out family finances, while figuring out, in a very uncertain employment atmosphere, figuring out career reinvention and all the other stuff that comes with it. I think it's been probably one of the most laborsome processes. We don't talk about it among the father community. There is a lot of self-stigmatization. There's a lot of hesitation to occupy space, like I said, for good reasons. And we don't have communities. We don't have spaces where fathers can come together and share this the way mothers can.
Thank you for that. So all of you have laid the groundwork really, really, really well for a rich discussion. So I want to get to kind of the idea of support and care and what that looks like. Here in the US at George Washington University, a group of researchers just put out a report card, the first time ever report card for the entire country in terms of maternal mental health, and 42 states got a D. I think Catherine alluded to just the terrible state of mental health in general. And then when you look at maternal, parental mental health care, it's even if you are at a stage where you know you have a problem and you want to seek help, in the already stressful stage of pregnancy or postpartum, it can be really, really challenging. There are good models. Several years ago, I reported on a great model. I think Catherine mentioned you're making maternal mental health part of obstetrics care. And I think that's a model that's growing, supporting obstetricians who are going to see patients right from the prenatal stage in like screening patients. I did a story about a similar model from Massachusetts, McPap for Moms, that's been spreading around the country. So I want to ask you, Boniface, tell us a little bit more about that nurturing care framework and what is going on in different countries in helping make that, what does that nurturing care look like for new families, for at the community level and at the healthcare system level?
Yeah, thank you very much. So I talked of the 2016 Lancet Series. I introduced the nurturing care framework. Now, where are we in terms of now applying the principles, out there? So in partnership with WHO and Witwatersrand University, based in South Africa, we commenced, on a journey to develop a package called Caring for the Caregiver. Look out for that package. If all goes well, we are going to launch in May, and to ensure that we send an invite. The Caring for the Caregiver package was validated in 6 countries. I will mention the countries in case others are here. I know Brazil. Brazil was one of the pilot countries. Bhutan. In Africa, it was in Sierra Leone, Rwanda, Zambia, and Serbia. So we have results. I'm not going to mention much of the results. I know the preliminary results because it's government data. 4 out of the 6 governments have given us a go-ahead. But the package, as you have lightly asked, we subject it to different platforms: health platform, nutrition platform, child protection platform. Caring for the Caregiver is not a program. It's an intervention that to implement within an existing platform. Because out there, like the context of Africa, for example, the countries I mentioned, the health system is already overwhelmed. doctors, pediatricians are seeing a lot of parents. And if you bring it as an separate, as a different program, they may not have the time. But we are bringing it into the existing program so that the frontline workers who are in touch with the pregnant, and the lactating mothers, and all the parents who are, who are going to the service facility. So this package brings now the support system, exactly what Catherine was saying. Asking this question to say, I'm a dad, I'm a mom, who else is around me? Because I think we have seen that is very important. They can go to a facility, yes, but the real issue happens also at home. So putting the family at the center, ensuring that the parents, the dads can also say, oh, it's not only the job of my spouse, I also have a bigger hand. Bringing also the cultural values. In some cultures, even just having a girl child, they want a male child. I was in one of the countries, I was shocked that these are the kind of realities. These kind of things you cannot see just driving in that community. But once you listen now, you realize the value of the family system, the spouses, the community, the traditional leaders. So that's why we are to build that kind of system. And we have gone beyond the pilot countries. This year we have already done Montenegro trainings. We did some in Iraq. We are soon going to do Sri Lanka. We have done Tanzania. So we are talking of about 13 countries now, trying to take that package, because we appreciate that within the existing systems, parents are in touch, but also find them at home so that they can get the necessary support. So in addition to the 5 components I mentioned of good health, adequate nutrition, responsive caregiving, we are supporting this responsive caregiving component by also bringing this, caring for the caregiver package. I'm going to share a link. The organizers are going to make it available. We have a platform called Agola. It's an introductory course where you can familiarize yourself. And, by the end of the day, we also issue a certificate. It's not like you are trained, but it's an introductory certificate. The package is being translated in Arabic, Spanish, and in French. And, lastly, we have developed an adolescent supplement because the needs of adolescents are also unique. So we hope by the time we launch in May, this adolescent supplement is also going to be out, because in some quarters, once you are 16, once you are 15 and you have a child, you are told you are old enough. Now the mental issues start to build. So she is also young, she needs parenting, and she's also having a child. So how do we handle that? So the specific needs of adolescents are unique. That's why we developed also the adolescent supplement. So I think I can stop. Yeah.
No, so can you tell us a little bit more about what that training and certification does? Like what kind of tools is it, and who's taking it? Is it community leaders, community members, family members, and what exactly is it training them to do?
Yes, so it takes, also how governments and systems are structured. But in principle, for example, health, we do a TOT, bringing people who can also have the capacity to trickle down, and these are the ones who train frontline workers. So these frontline workers are the ones who are doing home visitation, others
community
are doing
health
community
workers?
health workers. So could be group counseling, could be going to the homes, could be an ECD center. Those caregivers are the ones we are using now to reach out to the families.
And are they doing any kind of brief psychotherapy intervention, or are they more sort of learning to recognize what could be signs of mental health issues, or just being sort of observant about what supports a new family needs to be put around them?
More of that, identifying the support and bringing the awareness, and so that somebody can know that you are not alone. But we are very careful because it's a specialized field. 5 days, 10 days, you cannot claim that they can do that. Right. So we create also a referral system so that now they can say, oh, I'm in this situation, where can I go? So it also helps now to say you can go ABC and you can get the necessary support.
And does this work start in the sort of prenatal visits, or does it happen more postpartum?
It's more both. because as I indicated, we're even talking of adolescents, just, the preparation itself.
Right.
But we know the majority of the experience now when the child is born. But allow me to also put a highlight that the countries I mentioned, I talked of a pilot, but we also tend now to go full force. So we may not experience a lot currently because it's in the pilot mode. Yes, I just want to put also that note to the countries. Yeah. Yes.
Orly, tell us about you think about this a lot, work on this. What do you see as still needs to happen in supporting mothers in the period of matrescence?
I might take a little bit of a different stance on this, while also sharing that we, in many ways, are still piloting, really in general, all of this. It's a pretty nascent field, and awareness. We're still at the level of just getting the information, basic information, into the hands of mothers and frontline workers with parents. And I'd like to speak to caregivers at large as well.
So just basic education.
Yes, basic education, really sort of what I just keep on repeating. And that has to happen earlier and often. We're trying to train like sexual and reproductive health educators in school systems. The question I pose when should we start talking about this? When do people need to start thinking about their reproductive futures? Reproductive life planning is another idea above and beyond family planning, which was often very kind of, only around, women and reconsidering having another child. So my take on it is also inspiring from a strength-based perspective that you're about to embark, if you go down this path in general, in a very, as you say, I was really taken by what you said about this generation, really taking it into their own hands and wrestling with what is this really fundamentally about? What am I here to do? What is psychologically happening to me? And to really see that this is a pretty mind-blowing experience that has a lot of potential for remarkable change for the caregiver themselves, not just for the child. That those trickle-downs will, of course, inevitably happen, but we've really inherited a conceptual bias around child outcome and around disease, because it's a largely biomedical sort of psychiatric model. And so what I would want to inspire is that they can engage in a real encounter with what does this mean for me, and a meaning-making and a sense-making process, and that they may very well experience growth out of the tension of the suffering and the existential questioning around it, albeit the stress is not at the peak traumatic level. And to also invite everyone under this roomy umbrella. Everyone can fit under here, all genders and sexualities. Reproductive identity development and what can come, what the rewards, it could be so incredibly fruitful. And so I think we often came at it from a very reductionistic place. Mm-hmm. And when I speak with professionals, they sort of see it, have traditionally seen it in a reductionistic way. And I really love how expansive we're getting at it. If we can really give them a complete picture, a comprehensive education. We say that about comprehensive sex education. It used to be just abstinence only or focused on a little slice of the conversation. We really need to have it be quite comprehensive and to do it in developmentally appropriate ways, as we do with math or financial literacy. We start at kindergarten and we do something simple, and now we get more and more complex in the ideas so that we are prepared, whether we are truly prepared.
But at least you have some sense, because I think most parents, there is such cultural, I think this is the world over, when somebody is pregnant, a family is expecting, there's like, ooh, excitement, but nobody quite prepares you for the life transition, all the ways that the parents themselves are going to change. And I think along the way, as we're struggling, and for me personally, and I know I've had this conversation with a couple of colleagues here in the room in the last couple of days, that the identity crisis that can come, kind of everything that you're saying, Orly, about kind of juggling all the different parts of you and the systems not supporting caregiving. And I wish parents or expecting parents or anybody who at any point wants to have a child is like, at least somebody's out there talking about this more openly.
My joke is, as I say, I'm a recovering clinical psychologist and coming into being like a health educator in many ways. And I used to be covert, but now very overt positive psychologist. So we really have to marry the negative with the positive and really help people think more deeply about what is happening to them.
Yeah.
Thank you.
Tonmoy, what have you, I'm just curious from your personal perspective, but also stories you've done, like, where did you find support and help, and what have you seen in your reporting about where fathers are getting care, getting help, getting the support they need, and what more could be done on that front?
I think, while I was diagnosed when I was, I think, 18, for the next 22 odd years or 20 odd years of my life, I kind of like sleepwalked through life as if none of that existed and got busy sort of building a career so I could one day come to places like this. And all the while I was like self-harming and nobody had a clue. It was really bizarre, darkly funny in a way. And it actually was my father-in-law who dragged me by my hand and said, he's actually not a believer in like therapy and stuff. He's like, yeah, just talk it out. But when it came to me, he was like, you are coming with me to see a doctor. And in doing so, he really acted against his sort of like own DNA. And he saved my life. Those were conversations I could not have with my father or anybody from my sort of family. So I feel there is something beautiful that is happening here. I've spoken to a lot of male friends about this, and sort of this sort of father-in-law, son-in-law bonding is something that we don't talk about enough. I think all the sort of Hindi serials, they sort of obsess over mother-in-law, daughter-in-law nonsense.
And that's usually a very tense battle.
Really like. So this sort of father-in-law, son-in-law bond, it fascinates me a great deal because there's something happening there. The other thing that I have learned through my reporting is a question. What happens to fathers who are becoming fathers much later than their fathers became fathers?
Yeah.
Right? So my father was 27 odd when he had me. I was 35. And I'm so worried that by the time my son is of college-going age, I'm going to be like this doddering old man with no stamina
That's a
left.
constant conversation in my family. My
Right.
son's always like, okay,
Yeah.
when I'm 40, how old are you going to be? And I'm like,
Right. Yeah, exactly. So this is something that, again, a lot of men are grappling with. And now this is where the problem gets really complicated. So a lot of men who are becoming mindful and conscious of their problems. Now, of course, they now need to access care, and they are shedding the stigma, and they're saying, okay, I'm happy to go and talk to a professional about this. And there are no male therapists. There are no male therapists. I mean, the profession of therapy has become completely feminized, and for various different reasons. Of course, it's care work, and therefore more women should do it, etc. But there's also an economic reason. I've done an extensive story on this. My intern did a very amazing story on sort of the problems, why therapy has become such a female profession, and what does it mean for men, especially fathers, who are at this sort of stage in their lives where, the enormous emotional labor needed to sort of, first of all, say, I need care and I will, approach the system, but then, you're afraid that the person at the other end of the table will not be able to understand your experience. So there is that. The other thing that I've come across in my storytelling is middle-aged men, right? When you are sort of maybe 5, 6, 8 years into your parenting journey or your fatherhood journey, the amazing lack of research and stories in general about self-harm and suicide in that population, right? There is just so much attention towards mental health problems in younger people, right? And rightfully so. It needs to happen. But I was just talking the other day to a researcher in the UK, and he's probably one of the 3 people who have worked on middle-aged self-harm, which coincides with, the first few years of parenthood. Thankfully, we have some really happy examples of where men are finding support to deal with this, and I think we talked about this in our sort of a prep chat. Barbershops, are emerging as these sort of really transformational sort of
Here in the
hubs.
US too.
Yeah, I mean, I started looking at this phenomenon, because I read about some of this happening in the US, and then I went back to my barber in India, in Delhi, and I was like, does this happen to you? Do men come and unload? And he's like, all the time. So we talk about like community mental health and things like that, and when you talk about community mental health, you talk about like sort of ground level healthcare workers, you talk about imparting sort of basic literacy to people in neighborhoods, etc. It still sounds quite technical, right? Like there's some kind of like a formal process that you have to embed. But when it comes to things like barbershops, it's just amazing. It's just so organic. I say that.
So people have been doing this work for a long time and continue to do it without
and it's not formalized.
It's sort of like informal peer support.
And it makes so much sense because a lot of people hate their therapists, but I don't know of very many men who hate their barbers, number one. Number two, like...
Talk to my dad.
Well, my commiserations. But the other thing is like you learn to trust your barber with your literal neck, like very early in life. And that kind of trust, developing that kind of trust with your therapist takes forever. So yeah, that's a little happy sliver.
Thank you for that. So we're close. Before I throw it open to questions, a quick round of where each of you, and if you can answer this quickly, one or two threads or kinds of stories in the media that you would like to see covered more on caregiver mental health. I'll start with you, Boniface.
Yeah, I'm dreaming of a day where I should read more and more of integrated policies that are beyond a document, but implemented and also funded. So if we can tell governments that we need policies, because minus policies, things are not going to move. But policies alone are not enough. That's number one. Number two.
So we need stories about what's not working on the ground.
Stories, what is not working on the ground, real life experiences. But also related to that, community values and natural traditional systems. Cut and paste does not work when it comes to emotional things. People want things that they can resonate. So I think if we can write more unearth what is happening in that country, in that region, what others have passed through, because what we have learned is if I'm in a community X and I've said I've done this, I was there, this is what has happened, people are going to relate. So I think making the stories closer to reality is going to help us a lot. And finally, I would say, involve them. If it's the youth, let's ensure that we listen and we allow their ideas to be part of the conversation. Because sometimes we tend to think on behalf, but I think it's good also to involve everybody who is concerned. The caregivers out there, in some quarters, they may not have the resources. I'm using that word with due respect. But those are the kind of people that also we need to go and say, what should be done? Because sometimes we come with the publications and the evidence, but it's also time to say, what are your views there?
So ground up solutions.
Exactly like that. So I just want to mention those three.
Thank you. Orly?
Thanks for that question. I have to give it a think. Mine might be sort of a two-parter and almost may counter a little bit what was just suggested. It's almost in my findings with maternal health that a lot of it is first-person account, and I wish more of the science was there and that the interviews of the scholars doing the work, because this has been a very marginalized field. I mean, it's known as a pink science for a very long time, and I'm sitting here as a scholar myself saying that it's marginalized in the academia, it's marginalized in the funding, it's marginalized in so many places. It's having its moment now, femtech, all of these things. But I think highlighting the science legitimizes the first person accounts. And we've now gone the point of like from Me Too and bringing this sort of zeitgeist of, trusting in the voice of firsthand experience. But there are people, Catherine included here, toiling away, at the real science, and so incorporating it there. So I think that's sort of my, the one. And then the second one would be actually almost in a way the other side of that, which is especially around reproductive life. It's such an interesting time to be writing about it now. I think this is the time to introduce this, and identity really is having its moment as well, not only thinking about in a rational economic way reproductive life, the if, when, and how, the intentionalities, the wanted, not wanted, to really think of the who's, to really think about how people are really coming into understanding and knowing themselves in this sphere. People are delaying more and more. We have, whether we have access to contraception or not, the decoupling of sex and reproduction is a fairly new thing in the sort of psyche of the human being, while also these rapid reproductive technological advancements that are coming together that are allowing people to have children that wouldn't have been able to before, aside from, let's say, adoption. So that might be same-sex couples, that might be older parents or childless by choice. There are all these kind of new identities that are emerging because of the science, and to really keep sort of a watchful eye, like when we're thinking about like egg freezing as a benefit, whether it's whoever's giving it, what is the shadow side? How are we shaping the reproductive life courses of people when we, again, seem to not have a comprehensive understanding of the sunny and the shadow side of a lot of this material? So I'll end it there.
Thank you. Donmoy?
So I think one thing that we are not doing nearly enough as a community is following the money. So a lot of us instinctively feel that during the pandemic there was like this sharp spike in mental health reporting, right? And so as part of my part of a previous fellowship, I decided to dig into the data, and it turns out that if you take the time period of sort of one year before the WHO declaration of the pandemic, and then 1 year after, the number of stories on mental health in the global English language media went up 3 times, 3x, and the same was true of India as well. But when you look at, when you put in keywords like financing or economics or funding, it was 0. As a community, we don't know anything about where the money comes from in the mental health sector, where it goes, whether the money, the very little money that does come into the sector is actually going into the right areas that do need the funding. So that's one thing. And the second thing is specifically related to fatherhood. I think it is undeniable that a lot of men are feeling very lost and insecure and threatened, right? And particularly in the context of fatherhood, a lot of people would come and tell you in hushed whispers that what they're struggling the most with is that they're suddenly not the center of the world anymore, right? Like, it's not the sort of heliocentric sort of like, this is all about me. And that causes a sort of profound sense of, a loss, really. A lot of people are getting drawn into very populist, very angry, very sort of, hopeless visions of what being a man is all about. And it worries me because my son is going to grow up in that world. And that narrative is very seductive to feel like you are a victim, to feel like, you've inherited this sort of like world where you don't have any space. And as much as I celebrate what we have accomplished in one generation, I'm also seeing that in this particular generation that the lure of that really damaging and dangerous narrative around malehood can be so devastating. And I would urge all of us as a community to really get down to the sort of brass tacks of why that is happening, and even become a little bit of an advocate. This is not, very fashionable in journalism. We're not supposed to be advocates. But I think we have a lot of reasons to sort of, do advocacy around this. So, yeah.
Thank you. So we'll open it up to questions from the audience.
I'll go there. Come back. Hi. I'd like to ask a question when it comes to the economics or the finances behind having a village to support parents. So when I had kids, what I found was there were two camps. There were either the camp of parents who had kids and they were just killing it in their career and doing awesome, but they essentially hired an army of support behind them to cook and clean and nanny and everything. Or there were parents who, again, had the financial freedom or flexibility to bring in family members, and perhaps have a larger house to fit everybody in, to provide that first year of support, or even pay for other accommodations. And what I found was that the middle class parent, that, or what I kind of fell into, if you couldn't pay for it and you either maybe didn't even have the relationship with a familiar support, you just kind of fell through the cracks. So I always felt that economics plays a big role in how big of a village families have.
I thank you for that question. It's something I've certainly struggled with. Orly, do you want to take that? Have you?
Well, I see more than just two camps, but certainly this idea of having a web of support is the lack of web of support, I'll start with that, is a feeling that is very resonant to many of the parents of this generation that I speak to, because in the age of globalization, many of us are not nearby our family members in the same way. So there's been this dispersion of kin. And then you have this idea of having to replace it in some way. And so you could replace it through outsourcing and being able to afford that. Other people do it through sort of like, how, I don't know if you've heard the term NORC, a naturally occurring retirement community, but there's naturally occurring sort of family communities where you might move to towns in which there's other same age peers with same age children, and you sort of, work together. You do whatever it is that you have to do, gather the water together or carpool together. But there is this commiseration of understanding, where are the people, where are the hands? We need many hands for this. I think the financial piece would be one of the more straightforward ones, but I think it's also an opportunity to really understand how to build back community, or how is it that we're living, whether it's urban or in suburban or in rural areas. What is the web that you have? And so I'm not answering the question quite directly, but you have to almost really, it's individualized is the way I hear it. Every family, you have to work with them to really understand what they can do to fill the gaps, what is possible. And it's a very critical thing to do very, very early on, to have those things in place. I don't know if what's behind your question is also professional development, because it's co-pacing. And are you saying, the only way I'm going to get to evolve or continue to, continue the self and not sever it, right?
That too. And also I should preface that in my case, we were living in the San Francisco Bay Area, but there were young families who had packed up and moved for higher wages, but then they were disconnected with their support system. Or New York, for example.
Boniface, do you want to, do you have a piece of that also? Because, many countries around the world, you talked about local knowledge, local sort of systems. Unlike the US, many countries around the world still have cultural systems and better systems in place to support new parents, right?
Yes, we still have societies, especially the religious groups. We see them playing vital roles in some societies where they do a lot of, premarital counseling and the like, and also follow through the groups now of parents with children. It happens here also. I've seen some groups, but it's not like in some regions I've seen. But if I digest a bit on what you said also, I think time has come, if we engage other people to help us take care of our children, it's also how we position and define them. Because sometimes we just take them as hired to deliver. let's realize they are there to raise human beings. The way I also treat that person matters. I think you can agree with me, colleagues, there are cases where children are even more bonded to the worker than the parents. It means there's something that is happening in that home. Again, they should not take over the responsibility. If I had time, I would have talked of the Care for Child Development Package by UNICEF and WHO. Talks of incorporating play within the routines. I may be busy the whole day, but the 1 hour I'm in the home doing the routines is an opportunity for responsive caregiving. So I think those are the kind of opportunities. But to answer the question, yes, they are societies, but at the same time, when we hire, position them well. Number two, also now the little time I have in the home, I should maximize within the routines.
Sorry, we just have time for 2 quick questions, and we're breaking in 5.
Hi, my name is Roopsha. I'm from India. So, thanks for such an insightful discussion. Here we spoke about the need for mental health treatment or diagnosis, or the need and care for caregivers, and we also spoke about postpartum depression. Considering coming from India, there are several issues in identifying, diagnosing mother post-delivery with postpartum depression, but as a, like, my experience on ground as a reporter was different, because 2 years back I had done a story about the rising cases of suicide due to postnatal depression. So many of the women were taking their lives because of the depression after delivery. And but when I went and spoke to some of the doctors, and most of the doctors were from the government centers where they were being provided, like they had the facility to provide free treatment. So when I went and spoke to some of the doctors, they outlined that actually the women who had, many of the women who had taken their lives were being diagnosed with depression, but they refused to take the treatment because they didn't believe that they are suffering from depression, anxiety, or postpartum depression. So the doctors were helpless. They also tried to counsel the families, and ultimately they didn't take the treatment and they ended their life. So as a researcher, as a person who are working on the field, what do you think, like, as a role of a doctor or the family, what should be the role in such cases?
Can I take it before I throw it to you? So I think this is something that came up in our fellowship as well a couple years ago. And I think that's where mental health care providers have to be more sensitive. Every culture has its language of talking about mental illness that may not be terms from the DSM. I think that's where doctors and psychiatrists need to become, like in many, I know, African countries, they might talk about, or even in India, South Asia, they might talk about worries. They might talk about, like in Afghanistan, they say ghabrahat, right? That's anxiety. So I think that's where the mental health care field has to catch up to sort of local language, local knowledge. You can't, Boniface was talking about, you can't always do the top down, here are the big terms that frighten you. Am I right?
Mm-hmm.
Yeah. So one more question.
Yeah, Stephen from Zimbabwe. I sort of get, this idea that the journalist now is in a minefield, because you talk about a package that you have, and the package just comes to me when I'm quite exposed to a lot of situations that are happening. For example, I'll give you the stressors that happen. For example, you have the war in Gaza is taking place in our communities. There is climate change, the adverse climate change, conditions, and the journalist seems to be ignored in all this programming. I wonder even if from the researchers themselves, if they started deeper into the interventions that we are coming up, and we are saying, you, the journalists, take up this story and give it.
Actually, as Dart Center, we have a lot of research on the effects of and we'll get into it today. Actually, the secondary trauma that is on journalists. I think that's what you're referring to, Stephen. So maybe we can get back to that in a second. Sorry to intervene. Maybe we have time for the last quick one.
One last quick question.
Very quick.
Ridwan?
We had here. Okay.
Oh.
Sorry, there was. Okay, very quick.
Hi, thanks. My name is Pamela. So thanks to everyone. Tarmoy, I wanted to ask you something because, well, first, thanks for sharing your personal story. It was really, it made like a huge impact on me. So my question is, like, many of us may come from communities where it's a huge problem. We have a huge problem of violence against women and their kids. So, and you were talking about the perspective from a father who once was a kid. So I was wondering, sometimes when we think about it, we think about, okay, stop the violence, ni una menos, stop killing women, but we don't think about what happened with those kids that then become parents. So my question would be like, how can we help the parents? How, I mean, there's like, what would you say will help those fathers who want to have like a different response?
Okay, just one thing off the top of my head. I think every example of any person breaking free from toxic influences needs to be celebrated immediately, right? A lot of men, like I said, a lot of these angry men who grew up to be angry parents, it is drilled into their heads that they are unchangeable, that, you know, this is who you are, and that, okay, the world hates me because I'm like this, but then I will hate the world back because, you know, what are you going to do about it? Like there's this adversarial relationship between that person, between that man and the world. And increasingly there is this narrative which is, again, I understand that, well, if you're just being a decent person, you don't need a medal, right? Why do you need me to come and pat your back just because you're just being, you know, a decent human being? But I do feel that people who come from extremely toxic backgrounds and are doing the work almost completely on their own, they're reparenting themselves and they're trying to become better, right? We have to find ways to acknowledge that within families, within, you know, in society at large. How we do it without, you know, making it sound overly laudatory is different, but I think we do need to acknowledge the work that men are doing.
Can I add a quick thing before wrapping up? I think I used to cover gender-based violence like over a decade ago, and I think in the kind of public health community around the world, WHO and people who work on gender-based violence, there's been a growing recognition that started like over a decade ago about the importance of engaging men. And I think there is also very clear data that perpetrators of gender-based violence often grew up in very violent environments. Either they were victims of violence or they grew up in an environment that normalized violence. And so I think there is interesting work going on around the world in addressing that, and I think profiling some of those evidence-based programs might be a way to go. But I want to thank our wonderful panelists for this great discussion, and thank you all for being here.